I'm Leslie for Go Local, and today I'm in Lexington, Kentucky with Dr. Lance Ferguson of Commonwealth Eye Surgery.
Hi, Les.
Hi, thanks for taking the time to tell us about what you got going on here.
Yeah, it's pretty cool.
Okay, now this machine, it's a mouthful. Catalyst Precision Laser Cataract. What
Surgery.
is it? Okay.
You did work better than I can do, that's for sure.
What does this machine do?
Well, it does many of the steps in a normal cataract surgery with light rays alone rather than knives and all sorts of other instruments.
Yeah, we don't want the knives.
It's scary, isn't it?
Yeah,
when you
it
think
is,
about that.
you know.
The other thing that this does is it does it more accurately and very safely. And so it's become a part of our armamentarium for almost, well, a good percentage of our cataract procedures now.
Now, how long have you been doing this?
Since July, I would think June or July perhaps of this year, and so we've probably got several hundred cases under our belts already, so I'm a little bit used to the machine now.
Oh, awesome. Now, how's it different from the standard cataract surgery?
Well, standard cataract surgery, it's a very good procedure in itself, don't get me wrong, but there's a little bit of chance for error because the patient's eye can move or their body can move. And what's nice about this procedure is for the critical steps in the cataract surgery, it uses a soft vacuum fixation of the eye. It sounds, oh, that's kind of scary, but it's just a little silicone rim that fixates the eye, and it's painless to the patient when many of these steps are being performed. In fact, when this part of the procedure is being performed, we haven't even given patients any sedatives at that point, and they tolerate it very nicely.
So they're awake during the whole procedure?
Oh, and they're talking to me, you know, and sometimes I have to tell them, let's not talk for this part, but most of the time it's a little reassurance goes a long way.
Okay, absolutely. Well, does it hurt? I mean, it must not hurt if they're talking to you all the way through it. So,
you know,
I
don't.
there has to be something there. There has to be.
There's a little mild pressure to the eye, but it's not even as bad as, say, a LASIK procedure. And I tell patients if they close their eyes and push on their eyes, that's about what a LASIK procedure feels like. This, it's even less than that. It'd be kind of like if you were looking underwater for a little bit. It would look like you were underwater for a little bit. But it's very, very comfortable, and I've yet to hear anybody squawk about it.
Okay. Now, I know you've done so many of the standard procedures. What's the difference here? And why does this trump them?
Well, that's true. The more you do of something, the better you get at it. And over the years, I think we have shown a great deal of facility in a standard cataract procedure, but you can always make things a little bit better and a little bit safer. This is very similar to an autopilot in an aircraft. You have highly trained pilots in both seats. Nevertheless, the computer is faster than our hand-eye coordination, and it doesn't make mistakes, and we're really there to monitor it. And try as I might, I'm not as good as this thing. And I think it's a step in the right direction.
You've done a lot of them, though.
Absolutely. We've probably done for 30 years worth. I think that the ultimate reason why we use it is simply that it's better for our patients.
Okay, now that's important. So your eyes are in good hands here with Dr. Ferguson. So if you guys you have a need for this procedure, how can they find you?
On CommonwealthEyes.com.